Greetings from the Florida Behavioral Health Conference. It is so exciting to be here with other providers and to be able to see folks I haven't seen in years face to face and to learn about some great things that are happening. So I thought I'd take a minute just to share some highlights from day one. The session in the morning started with filmmaker Brett Culp. He was pretty amazing. Really shared some inspirational stories based on his documentary work. That really talked about leadership and going down kind of a mentoring route instead of a managing, supervising. So just some great tips and insight how to mentor, how to talk about hope. And, we've all been through so much this last year and a half. And so some really insights about how do we take that and continue to grow and evolve and support one another. So some great things. I think he's got some great documentaries you can bring to your community. So definitely go check out Brett as the filmmaker, Brett Culp. Heard from TheraAssist. Really great insights on making sure your documentation is compliant, that you don't have to do paybacks. So some really great tips because obviously we do great work, right? But you don't want to then have to pay back because something wasn't documented correctly or you used a template for patients too many times when doing your treatment planning. So some great tips there. Really love some of the thoughts I had on your EHR and making sure that the timing is recorded correctly there. So great insights, happy to connect you with them. Then had a great lunch and learn where we just had a great conversation with Mark Stavros from FSU, who's an emergency medicine doc and also a addiction medicine, talking about medication-assisted treatment. Love the conversation about benzodiazepines. Organizations will sometimes just have a blanket policy around benzos. How do we recognize and meet people where they are? Lots of great conversation about people-first treatment and how do we address a lot of issues around medication-assisted treatment. So really enjoyed that as well. And the last session today was great. Rebel Recovery, a recovery-oriented, peer recovery-led organization in Southeast Florida, really talking about their work in bringing recovery specialists and peers into the jails to really build that relationship and help people as they transition into the community, really reducing recidivism. Great initiative funded partly by the managing entity in their region with some funding from the local sheriff's office and the criminal justice system. A real community effort to get those recovery specialists in there and help folks. So really nice to hear innovative program. And of course, it was great just networking, seeing so many of you, and look forward to sharing some highlights from day 2.